Good morning or good afternoon. This is Professor El Nahas, and this talk is about critical thinking and the 5 whats. You will see that throughout the talk, the Transplantation Online Course, we will work together and put a lot of emphasis on critical thinking. And over again, we'll be asking the 5 whats. This could be applied when we talk about an investigation, could be applied when we talk about management, and it could be applied really in any decision making in nephrology and in renal transplantation. So what are the 5 whats? First what, second what, third what, fourth what, and fifth what. What are they and how do they fit in our critical thinking philosophy within the talk, and how will we apply the 5 whats with you on a daily basis in our nephrology practice. So the first what, there are the 5 whats. The first what, it is what is the process for. So if we talk about an investigation, what is the investigation for? What is the X-ray for? What is the renal biopsy for? What is the CT scan or MRI for? If we talk about an intervention or a drug or a procedure, what is the intervention for? And we need to ask this question. It seems self-evident. However, we need to ask ourselves all the time in all our medical practices why we're doing what we're doing. Because it's only by asking what is it for, then we'll be able to justify the intervention, justify the procedure, and do it to the best of our abilities and to the best of the patient's interest. So the first what is what for? What justifies what I want to do? And we need to ask ourselves that. The second what is the evidence that the test we're requiring, the investigation, X-ray, renal biopsy, or intervention we're about to apply to the patient, be it immunosuppression, be it steroid therapy, be it ACE inhibition, be it immunosuppression, statin therapy. What is the evidence that it will make a difference? What is the validity and the strength of the evidence out there in the literature, out there in the guidelines that justify the procedure or the intervention or the treatment we are embarking on? And again, that's an important point because it could be justified. However, when we look at the evidence to support the fact that we want to treat a patient in a given way, we may find that the evidence is not there. And then we'll have to fall on the third and fourth and fifth what to justify our action. The third what is, what's the relevance? A procedure that may be justified in principle, has good validity for a 20-year-old, a 30-year-old, may be totally irrelevant to a 70 or 80-year-old. So we need to put it in the context of the patient we're dealing with. May be relevant in China or in Japan and very effective there, but totally useless, irrelevant, and potentially dangerous in the culture we are practicing in. So we need to look at the context, the usefulness of the intervention, the test, the procedure to our own patient. It's not enough to look at guidelines designed in the United States, Canada, Australia that may not be applicable to our patients in emerging countries, in the Middle East, in North Africa, in Asia, or in Africa. That's the third what, the utility or the usefulness for our patient of what we're embarking on. The fourth what is equally important, and that's a risk versus benefit analysis of what we do. We always need to think of any intervention, procedure, test, screening, management, treatment, immunosuppression or otherwise. What is the risk and what is the benefit? And unless the benefit significantly outweigh the risk, then the procedure cannot be justified. If the risk is higher than the benefit, you wouldn't considering applying neither the test, nor the procedure, nor the treatment, nor whatever medical action you're embarking on. So it's very important to know the balance between the risk of what we're embarking on, the potential benefits of what we're embarking on, in order to have a balanced and safe view of our medical action. And finally, the fifth what is the cost benefit. You can have two interventions that are equally effective. One happens to be 10 times more expensive than the other. Then you would not use it and you would go and reconsider your intervention and look at a cheaper option, especially if the patient is paying for the intervention, especially if it will impact on the patient's final decision making and action. So the cost of a procedure is important because we need to be more and more conscious of health economics and again balance the benefit of a procedure versus its cost. There are interventions that are very effective but may cost as much as $500,000 per year for a single patient. For instance, eculizumab. And there may be another intervention equally effective, for instance, with high-dose intravenous immunoglobulin, IVIG. Then why pay $500,000 for a monoclonal antibody when I may get the same benefit? And that's the whole point, your cost versus benefit, with a much cheaper procedure. So I think throughout the NOC and throughout the talk, which is Transplantation Online Course, that we're embarking on, I want you to constantly make a habit of thinking along these 5 lines. What for? What's the evidence? What's the usefulness? What's the risk versus benefit? What's the cost versus benefit of anything you do? So critical thinking, reflective thinking, which will enhance your medical practice. In terms of assignment, during your introduction period for the Transplantation Online course, you will be required to write a mini essay, 500 words, no more, minimum 400 words, on critical thinking and its role in decision making in medical practice. So go on the internet, read about critical thinking in order to be able to summarize your reading, provide the references to your reading, and put it all in a small mini essay on critical thinking and its place in clinical medicine and in transplantation nephrology. Thank you very much for your attention. This is the end of my talk on the 5 what's in the context of critical thinking that we will apply to our Transplantation Online course. Thank you for your attention.